Welcome everybody to Infant Feeding, Introduction to Solids. My name is Jaclyn Adler. I'm one of the dietitians with the Hamilton Family Health Team, and I'm the Nutrition Program Coordinator here as well. I'm joined today by my colleague Meagan Sullivan, another one of our dietitians with the Family Health Team. And so today we are going to be talking about introducing solids to your babies. And we certainly recognize that now is a difficult time, not only because of COVID, but it is enhanced if you have a new baby at home. It's got to be, we empathize with new moms during this time. It's got to be hard without being able to talk to other new moms at mommy groups or those baby lessons. And this is often a place where you would get a lot of information, right? And so today we're hoping to supplement some of that, maybe to clarify some knowledge that you already have, or to share some new knowledge that you may not have been able to find online or from your mom friends, and so, or parent friends. And so today we're going to answer your questions about key nutrients for optimal health during infancy, how to introduce solids to your baby, common myths about infant feeding and food safety, managing constipation, and more. Just so that you know, we do have some time for questions. There's a chat function on your the bottom of your screen that you should be able to access. And during the entire webinar, you can enter a question into that chat, and we'd be happy to address it at the end. We also have a couple of polling questions at the end that I'll activate at the end of the session. This is really for our program development, so that we can make this as improve and make it as good as possible for you. Sorry, one second. My apologies. So, when should I introduce solid foods to my baby? Between 4 and 6 months is ideal. There's a big gap between 4 and 6 months. Babies definitely develop a lot in that 2-month period. And certainly you need to use some of your own instinct and guidance to decide whether baby is ready. So you should always go based on whether they are ready for solids, if they're sitting up, able to hold their head up straight. If they don't need to be able to sit up independently, but with support, they do need to be able to sit up for safety reasons. And primarily if they're showing interest and reaching for food, if you have something and they're looking interested in it and opening their mouth for it, that'd be a great sign that they are interested in solids. So how do I know my baby is ready to start? So looking for signs of readiness, including sit and lean forward and backward independently. Like I said, some chairs are a bit bigger, and it is great to put them into a high chair because it gives them that added support. It makes it a bit safer. Being able to sit up without any support comes a little bit later. So it is okay if you need to prop them up a little bit. Follow food with their eyes. So they're showing that interest, they want it, they're looking excited, opening their mouth wide before you offer that food, and then they hold their head up and turn towards or away from food. Primary nutrient of interest at this age is iron. This is something that we really focus on at this age. At 6 months, the baby's iron stores that he or she took from mom when they were growing in utero are almost gone. And so we need to start supplementing that from complementary foods. And so dietary sources become super important at this age, given that breast milk alone is not an adequate source of iron. We need to offer small amounts of iron-rich foods at least once, twice a day at the very least, and gradually working up to 3 times a day. We kind of say at every opportunity there should be some source of iron. Iron-rich foods can look like chicken, fish, beef, eggs, tofu, legumes like lentils, beans, and chickpeas, as well as iron fortified cereal. These are a very easy way to get iron into the baby. And so the cereals, there's tons of different options, different grains, different flavors. And so you can keep that variety, but know reliably that it is well fortified with iron.
Okay, so how do I introduce solid foods to my baby? You can introduce foods in any order. You want to make sure, though, the emphasis is on iron-rich foods. Like Jaclyn said, this nutrient is very important once we hit 6 months. And we do encourage a minimum of 2 times per day, with increasing up to 3 or more times per day. We do suggest you begin with 1 grain at a time, just to make digestion a little easier for babe. So you might start with rice cereal and then move on to single grain of oat cereal, barley, etc. You're not going to want to give any mixed grains at this time. And we also really encourage gradual transition of texture, and we'll discuss that in more detail later in the presentation. We want you to continue to give breast milk, obviously with the vitamin B supplement or the formula. So this adding solid foods at 6 months is really in addition to the milk source that you've been giving your baby all along. And we're adding it specifically because the iron amounts babe needs at this age is vastly increased. One thing of note, one thing to note is that we do recommend delaying cow's milk until baby is eating a variety of iron-rich foods. So we want babe well established on iron-rich foods before we introduce cow's milk, and that's because cow's milk can inhibit the absorption of iron from food. I will talk about that later in the presentation. Another thing we get asked a lot is about allergenic foods. We do encourage offering allergenic foods every 2 days, and you're going to assess for reaction. I'm going to talk more about allergies a little later. How much should my baby eat? This is a very common question we get. We always recommend that you let the baby guide you. And baby will tell you when they're full by using nonverbal communication, usually at this age. So they'll turn their head away, they may push the spoon away, they also will close their mouth. And we really want to respect babe when he or she communicates that they're done having their food. That means they're full. So you're going to start with a small amount of 2 to 3 teaspoons per meal, and you're going to increase gradually up to 2 to 4 tablespoons per meal of food. And then over the next month or 2, leading up to 9 months of age, we are working towards providing 2 to 3 larger meals per day with 1 or 2 smaller feedings or snacks in there. So texture, what textures can my baby have? We're really encouraging offering a variety of different textures. So moving from pureed into lumpy, ground, or mashed textures is very important for baby to learn the skills of eating that include chewing, moving the food around in their mouth, and then swallowing. An example I like to use is peas. So you can start with some pureed peas, then move on to not pureeing it as much and leave it a little lumpy, then into ground, and then finally mashing it with a fork so that you still have a lot of texture in there, but it's very soft and easy for babe to move around in their mouth and swallow. Then you can move on to pieces of soft cooked food, like soft pieces of sweet potatoes or other fruits and vegetables, or even some fish and chicken if it's cooked very softly or ground. You can then, once baby is well established on a variety of those textures, you can move on to finger foods to feed by themselves, such as finely minced or mashed cooked meats, soft ripe fruits, or pieces of soft cooked vegetables. Other easy things babe can probably handle at this stage would be some grated cheese or some bread crusts. And one misconception is that babe does not need teeth in order to advance from purees. They actually can do quite well with their gums, moving those foods around and grinding them up in their mouth. Another thing that we want to start thinking about at 6 months of age, just like ready for solid foods, that's also when we recommend moving a babe into learning how to drink from an open cup. We know that moms and dads quite often like using sippy cups. However, those do not help babe learn to drink from an open cup because they use very different muscles in the mouth when you use a sippy cup. So we really ask the parents try and do a little bit of open cup drinking where you assist the child, like in the picture here, with an open cup and let them open their mouth and take some liquid into their mouth. The next thing when it comes to cups is around 9 months of age, we recommend that if you are using bottles, that you start weaning baby from those bottles. So you start picking 1 or 2 bottles within your routine and you move them to an open cup for their milk source or water or whatever you're putting in the bottle. And then by 1 year of age, we actually encourage parents to work towards being bottle free completely. Babe is at a developmental stage at 1 year where they can be drinking from an open cup or straw for their milk source. And so we really don't want, also bottles can cause different kind of issues with teeth and other developmental things that happen over year age. So if you can get bottle free by a year, that is ideal. So something very important for moms and dads is how you keep your child safe when they're eating. So what we really want to start with is making sure that the foods you're offering are safe. So avoid hard or round foods like popcorn, whole carrots or grapes or hot dogs. Those can be major choking hazards. So you want to make sure foods are soft and well cooked until your baby is able to progress safely to harder foods. So as you're moving along in those textures that we talked about before, once you see that your child is handling those textures well, without any problems, then you keep moving on to maybe a little bit harder foods. You'll be able to use your baby's cues to know when they're ready. Very, very important to never leave baby alone while eating. You want to be there by their side, sitting with them, making sure that all of this new learning around food is going well and that they don't need any help from you. And never serve foods when your baby is crawling, cruising, or toddling. They're very unsteady on their feet and in their mobility at these young ages, which can increase choking hazards. So please have them ideally up in a high chair when they're eating. The one thing you're not going to want to give babe until a year of age is honey. And that's because honey, even if it is pasteurized, unpasteurized, can contain bacterial spores that if babe ingests, those spores can grow more bacteria and worst case scenarios can cause some paralysis. So you can offer honey once they become a year of age because they have developed the right bacteria, good bacteria in their gut to give them immunity against these spores. So over a year of age, you're more than safe to offer honey. Okay, so we mentioned earlier about allergies and are there foods I should avoid giving to my baby to prevent an allergy? This is a big concern for parents. So really there is no need to delay the introduction of foods such as egg, fish, peanut butter, any of those high allergen foods. The Canadian Pediatric Society actually recommends introducing these foods at 6 months, even in infants at high risk of allergy. A lot of strong research and evidence has shown that this actually prevents allergy rather than delaying. And so how you're going to go about this, you want to ensure that you introduce in very small amounts. So for an example, if it was peanut butter, you can just rub a little bit on the inside of babe's mouth. And you're going to want to watch for any reactions. Those reactions can be immediate or delayed, so please keep an eye out for any of these things to happen. Some things to look out for would be hives or welts, rashes or flushing in the skin, swelling of the face, mouth, or tongue, even stronger reactions such as vomiting, diarrhea, wheezing, or shortness of breath. If you see any of those more extreme reactions, you're going to want to call your doctor's office or head to an urgent care if they're not available, just to make sure baby is okay. And then if there's no reactions, ideally and hopefully, you're going to want to wait 2 days before you introduce another new high allergen food and do the same process over again, watch for reaction. When can I introduce cow's milk to my baby? So we mentioned before that we like to delay cow's milk ideally until babe is at least 9 months of age. And that's to ensure that they're well established on iron-rich foods because cow's milk can interfere with iron absorption. But once they're well established on iron, it's no problem at all. We do recommend homogenized cow's milk from an open cup at this age. If you prefer not to have cow's milk, another substitute could be goat's milk, but you want to check the product you're purchasing and make sure it's pasteurized and also fortified with vitamin D and folic acid because goat's milk are not naturally high in these things. Can I give my baby other milks like almond milks? So these other milks are very popular and coming increasingly more popular in the past few years here in Canada. The answer is that we actually do not recommend plant-based drinks for babies. Up to 2 years of age, children have a high growth velocity and developmental that requires adequate amounts of protein and fat. So almond, coconut, rice, hemp beverages are very low in protein and fat, and so they don't provide those nutrients needed for adequate growth. So for example of that is 1 cup of almond milk has only 1 gram of protein, compared to cow's milk has 8 grams of protein. Although soy milk has similar protein to cow's milk, it's very low in fat, and that's why it's not recommended until a child is over 2 years of age. How often does baby need to eat during the day?
So, my turn, sorry.
Yeah, sorry about that.
I was thinking that this is something that you need to think about where food fits into formula or breastfeeding, right? And so we do say that, you know, offer it based on their interests and based on their needs. 2 hours apart does work quite well to offer meals and snacks, but primarily go according to baby's hunger cues. They're growing very quickly, and so sometimes babies will want to eat a little bit more often, and that's okay. But they do have really tiny tummies, so respect that tiny tummy, offer them only the amount that they want to eat, and then know that you're going to offer it again if that was only a small amount. So what is your and your baby's responsibility around eating? This is something that we promote throughout feeding children, and it starts really in infancy. So when introducing solid foods, you are responsible as the parent or caregiver for what kind of food your baby is offered, when the food is offered, and where the food is offered. So, you know, offering a variety of iron-rich foods, healthy alternatives at a somewhat scheduled according to their hunger cues, and sitting in a safe environment like in a high chair, for example. We do really want you to trust your baby to decide if they will eat at all and how much they will eat at that time. Babies know when they're hungry and full, and they will tell you so. As we talked about earlier, they'll show you those cues. And so we really want you to encourage that. It helps to foster that good relationship with food, as well as the trust between you and baby to feed them when they're hungry and stop when they're full. Is organic food better for baby? I can't say that I agree that it would be better. There's no significant nutritional difference. They vary in pesticide levels. There are different pesticides for organic food than for commercially produced fruits and vegetables. There are high pesticide levels in strawberries, raspberries, cherries, apples, bell peppers. Those fruits and vegetables without that hard shell typically have the higher pesticide levels. And those with the lower pesticide levels typically are broccoli, cauliflower, corn, bananas, avocados, peas, pineapples, and mangoes. So if you do want to choose some with lower pesticide, that might be a good starting point, rather than just having a blanket statement of doing organic versus non-organic. So what is baby-led weaning? You may have heard about baby-led weaning from friends or online. This method is just a different approach to starting your baby on solids. We would be comparing it to spoon feeding purees, which is more of the traditional way to introduce foods. Baby-led weaning allows your baby to feed themselves soft cooked, cut up finger foods right away. So typically, as that baby looks like, they're just gnawing on some broccoli, and it's well cooked probably, and able to be soft enough that baby can handle and do themselves. Some of the advantages of baby-led weaning is that it allows you to feed your baby the same food that you may be feeding the rest of your family. This can help the baby be less picky eater and accept different foods later on. And it is considered more enjoyable, less expensive, and a healthier way to feed babies by some parents. There are some disadvantages to baby-led weaning. There's the potential for inadequate iron intake. If baby isn't taking or isn't really eating enough and swallowing much of that iron-rich food like meats and fish and chicken. There's potential for inadequate energy intake. If baby's in charge of how much they eat, they may eat a little bit less than they need. And this may lead to slower growth. So it's important just to pay attention and be constantly or checking in and making sure that baby is getting enough iron and enough energy. one of the things I do recommend is thinking about individual babies when you're considering baby-led weaning versus traditional pureed. And in the cases where babies are maybe slower to grow at the beginning of life or smaller on the growth chart and maybe fluctuating on the growth chart, I would probably encourage a combination of baby-led weaning and spoon feeding to ensure you foster that good relationship with food and allow baby to sort of play and feed themselves, but also you can feel safe and know that your baby is getting what they need by you feeding them. This might look like offering iron-rich foods such as the baby cereal and use spoon feeding, as well as a piece of soft banana that baby can then hold and feed themselves. One of the big questions around baby-led weaning is around choking. And there's really no evidence to suggest that baby-led weaning increases risk of choking as long as the food is prepared properly and they're sitting in a safe environment. Babies typically can choke on purees, and so it's important to know the difference between choking and gagging so that you can feel confident and prepared to feed baby in either method. So if you do want to choose baby-led weaning, this is how you might go about it. You might offer an iron-rich food at every meal, such as the foods we've talked about already. Offer soft cooked, cut up finger foods that can be grasped by your baby's fist during meals, and then just allow them to feed themselves. This means letting them decide how much they're going to eat and then from the foods that you have offered. If they're still looking hungry, you're going to offer a little bit more, and if they're done, then that's great, even if there's food still on the plate. Back to you, Meagan.
My baby is constipated, what should I do? So this is a very common thing that we get asked about, and it may be something that you come across in your baby when you start solid foods. So what is constipation? So I want to reassure you that every baby is different, and it may be normal for some babies to have 3 bowel movements in a day and normal for another baby to have a bowel movement every 3 days. So what you really want to look at is more objective things when it comes to constipation. What the stool is going to change in consistency, smell, color when you introduce solid foods. So expect it to change. What you want to look for though, constipation would be if the stool is very small and very round, hard pellets coming out. You also want to look for increased in pain with babe when they're going to have their bowel movement. Very normal for babe to make a face like this little character on the slide when they are having a bowel movement. But if that's associated with crying and pain, and then you look at the stool coming out and it's small, round, and hard, then that is going to be constipation. And so what can we do for constipation if it does happen? A really effective way of dealing with constipation is increasing baby's fluid intake. So if you're breastfeeding, we recommend breastfeeding more frequently. Another idea would be to offer some pureed fruits. So traditionally, pureed prunes have worked quite well, as well as pureed dates or pears also work quite well. You want to increase their intake of those things to help with soften the stool and make it a little easier for babe to pass. If you have constipation concerns before babe is 4 to 5 months and not on any food yet, you can boil water for 5 minutes, let it cool, and give babe 1 tablespoon of this water 2 times a day and see if that helps the stool pass a little easier. And if you've already had rice cereal, you can switch and try oat or barley cereals as they're higher in fiber. If you find that you're seeing though any blood or mucus in the stool that is constipated, we would encourage you to call your doctor's office about that and get a consultation with a doctor or dietitian about it. So, whole new world for babe is starting foods. And so depending on where you're at in starting solid foods with your baby, we'd like you to set a goal. So for some parents, if they haven't started food yet, it might be time to start, and that's the goal of starting something iron rich. Or if you've already started solid foods, but you haven't really started much iron-rich foods, maybe your goal could be that you're going to start including more iron-rich foods. So I want you to think about one thing you're going to do this week when it comes to feeding your infant that you can do. Help them progress. Maybe it's in texture or in variety of food, depending on where you are. Very, very important with babes because they are growing and developing at such a rapid pace that we identify nutrition issues early. So we do encourage you to meet with your RD between 4 to 6 months of age. If you have a Hamilton Family Health Team doctor, they are associated with an RD, and you have access to a dietitian to make an assessment and give you extra knowledge, and you can ask plenty of questions. Also a good idea to check in again around 9 months to see how things are going with solid foods and how things are progressing, and if there's any kind of problems you need solved with your dietitian. Again, earlier intervention and education sets you and your baby up for feeding success and can reduce tendencies towards picky eating as they age. If you do have a nutrition question, you can email the dietitians at the Hamilton Family Health Team. Our website is www.hamiltonfht.ca. You can also call your family doctor's office to book an appointment with your physician, dietitian, or nurse. Another option is you can join us again next week. We have another infant feeding online webinar next Wednesday, July 15th from 1 to 2 o'clock. We're going to be talking about that time between 6 to 9 months, transitioning textures, teething, as well as being able to read your baby's cues around foods. Some great reliable websites that we recommend are dietitians.ca, unlockfood.ca, or another good one is beststart.com.
So thank you so much for joining us today. Thanks, Megan, for joining me. We do have, like I mentioned at the beginning, a couple of polling questions that I'll just launch right now. And then after that, we will take a peek at the chat and see if there's any questions from our participants. So maybe we can do it at the same time. If anybody wants to fill out the poll while we're talking about the questions. I can see a question coming in already, Megan. I wondered if you wanted to field that one. It says, I heard that food before 1 is just for fun. Do you think that's true, or what can we say about that?
I've heard this before for sure. It's definitely not true. Food before 1 is actually important for a variety of reasons. It's important for nutrition. Babies' needs of iron, which we talked about, greatly increase between 6 to 12 months. From 0 to 6 months, they're recommended as barely any iron needed. From 6 to 12 months, it's recommended they need 11 milligrams of iron a day, and then it drops down to 7 milligrams a day after they're 1. So food is definitely not just for fun, it's also for nutrition during this time. It's also very important for developing good feeding skills, learning how to chew, move food around in your mouth, and swallow. We talked earlier about that texture progression, and so that's very important. The earlier we do that, we're already getting ahead and giving babe those skills for eating solid foods. Another thing to think about is that we want to introduce foods earlier in life so that if there are any problems, with swallowing, if you notice your baby's not progressing in texture as well as you would like, we may need to involve different interventions from occupational therapy or an SLP. So the earlier we introduce foods and the earlier we're able to catch maybe some of those hiccups, the better babe will be long term. So no, food is definitely not just for fun until 1.
Absolutely. I also think that just for learning about food, developing those skills, learning that variety, that time in that first 6 months is, I find, when babies are most adventurous and they're willing to take a taste of almost anything. And so you kind of want to foster that and introduce as much variety as you can in those early days to help foster that good relationship, as well as reduce the likelihood of picky eating later on. So what do you think about, how do you know if baby is eating enough or getting enough iron?
Really good question. So every baby is different. Some babies, will eat small amounts and that's enough for them. Other babies eat quite a large amount and that's enough for them. So you want to listen to baby's cues that we talked about before. If you know you're offering your child solid foods 3 to 5 times a day in their high chair, and they eat just a small amount and then refuse, then that might be all that they need, especially if they're not showing any signs of, delayed in growth or fussiness or pale skin or other signs that they may not be getting enough. And then you want to contact your doctor if you are seeing any of those things. When it comes to iron, iron can be a little bit more mathematical. So what babe is needing from 6 to 12 months, we talked about, is 11 milligrams of iron a day, which is quite a bit of iron. So about 2 tablespoons of a fortified infant cereal gives us about 3 milligrams of iron, compared to 2 tablespoons of beef only gives 0.5 milligrams of iron. So if you're just going to use, if you're not going to use infant cereals, babe needs to eat a lot of meat and alternatives to get their 11 milligrams a day. Whereas with infant cereal, I just find it's at this age and stage very important for getting your iron. It's just an easier way for parents to ensure babe is getting it. So if 2 tablespoons has 3 milligrams and you offer that 3 times a day, then that's 9 milligrams of iron. And then at a couple other times offering those meats and alternatives, you can ensure babe is getting the 11 milligrams. And it can be fed, you know, mixed with, you know, you can mix it with some fruit or vegetable. You can also make pancakes or other things like that with the infant cereals, just to give babe some variety.
Absolutely. So do you see the Q&A, any questions on your end?
Yes, there is one here. My husband has a dairy allergy. Does this affect when I introduce milk and dairy to my baby?
That would put, so I would say if it's a true cow's milk protein allergy that one of the parents have, then you would consider your baby at higher risk of developing an allergy. It doesn't mean automatically that baby will develop an allergy, but you would just be on a little bit higher alert. There are other things that we look for, such as eczema on the baby or dermatitis, any sort of skin issues that can be combined to think that baby would be at higher risk. And parental allergies is part of that equation. So certainly it doesn't mean that you wouldn't delay. You would probably, it doesn't mean that you wouldn't introduce it. You would probably introduce it earlier than later, but for the same reason as Meagan mentioned earlier, that we have found evidence that earlier introduction of allergens helps to minimize the actual development of allergic reactions to food. So you'd probably do it a little bit earlier, but just be on alert that there could be an allergic reaction to dairy.
So yeah, you just look for those reactions we talked about. And if you see any, please get in touch with your doctor. And you might need a fuller nutrition assessment and assessment by your physician to see how much babe is being affected by that.
Absolutely. Yeah. Any other questions on your end, Meagan?
Nope, don't see any on my end. How about you?
Nope, no other questions over here. I think we pretty much covered everything. And given that next week we're going to talk about that 6 to 9 month life session, as well as the following week we're going to have our 3rd session in our infant feeding series on introducing foods and a variety of foods at 9 to 12 months and what that looks like and how different that is than in the earlier introduction months. So please join us again. We look forward to talking again with you over the next 2 weeks. And, you know, if you have any, sometimes, you know, a lot of the guidelines and the theories, it feels like it's good, and then it might not apply to you in every situation. So we certainly encourage you to get in touch with your doctor's office, talk to the dietitian that you have or the nurse that you have available to you to take these guidelines and make them meaningful to you. So thank you for joining us today, and we'll look forward to seeing you next week.